Pneumonia is a common symptom of COVID-19, but it can also be caused by other viral infections. Bacteria can also cause it, and early symptoms are similar to flu symptoms: coughing, fever, muscle aches, as well as headaches. But one thing we need to know is that pneumonia can be life-threatening, and medical help is very important, especially during these challenging times. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines, where your health comes first. Most people who get COVID-19 have mild or moderate symptoms, but some get severe pneumonia in their lungs. Joining us are Dr. Ivan Villespin. He's a pulmonologist and associate professor of medicine at the UST Faculty of Medicine and the immediate past president of the Philippine College of Chest Physicians. Also joining us is Dr. MARION AURELLADO-KWEK, an infectious disease specialist and consultant at the Asian Hospital and Medical Center. Thank you both for joining us on today's program. Now, it's easy to confuse pneumonia with flu. They have so much in common, yung symptoms of cough, fever, muscle aches, among others. Dr. Marion, how do you differentiate the two?
Pneumonia is a general term used for infection in the lungs. So what happens in pneumonia is your air sacs where the gas exchange happens in the lungs become inflamed, and it makes it difficult for you to breathe because you can have fluid accumulation or even pus in those structures. For influenza, it's a respiratory illness that can cause mild to severe symptoms, and it is caused by the influenza virus.
And pneumonia can also be a medical emergency, especially for high-risk groups such as the elderly as well as the young. Why is this so? Dr. Ivan, what happens to a person who gets pneumonia?
Well, let me start by saying this. There are two major types of pneumonia. One is an infectious type, and the other one is a non-infectious type. And we have to understand that when the patient develops pneumonia, the alveoli, which looks like a bunch of grapes, will be filled with fluid and pus, which makes the breathing labored, sometimes painful, and limits the entry of oxygen into the blood, causing hypoxemia. And that will lead to acute respiratory failure and eventually death. So that's a problem.
So that's a very good and concise way of explaining the progression of infectious type of pneumonia. Now, the symptoms of pneumonia are very similar to that of COVID-19 symptoms. Dr. Marion, how do you differentiate a viral from a bacterial type of pneumonia?
Well, like you said, Dr. Fred, so it's similar in presentation at the start, but a common difference that we encounter is most viral pneumonia tend to be dry, meaning they don't have productive phlegm in contrast to someone with bacterial pneumonia. But for both types, they can present with fever, difficulty of breathing, and it's very difficult to differentiate the two without having to do any tests. So you really have to get tested, especially for COVID-19. We don't just label someone as a confirmed case without having testing done.
Dr. Ivan, among the symptoms of pneumonia, which one there should our viewers really watch out for when it comes to it being progressive to a mild or a severe type of symptom already?
That's a very tough question, Dr. Freddy. Perhaps the most important distinction between bacteria and viruses is that antibiotic drugs usually kill bacteria, but they're not effective against viruses. Now, regarding symptomatology, there are no really symptoms that will say that this is COVID pneumonia, this is the bacterial pneumonia. Asked me already about COVID pneumonia. There's a nice study that looked at the chronology of events when we talk about COVID pneumonia. It usually starts with a fever and chills, followed by cough, which may be dry or productive with yellowish, greenish, or even blood-stained sputum. Then you will have nausea, vomiting, or even diarrhea. And these are symptoms that would point more to what we call as a COVID-associated pneumonia. You should be bothered by that already.
Okay, that's good. But also, Dr. Ivan, there is such a case where a person may have pneumonia, but they don't show any symptoms at all with this. What should our viewers know about that? Is this something that they should be worried about?
I think you're referring to the asymptomatic variety or the asymptomatic phenotype of pneumonia.
Yes.
Indeed, that still remains enigmatic. But if we look at the data about this kind of pneumonia, But again, the symptoms or the clinical signs are very nonspecific, and that compels us, therefore, doctors to do laboratory tests or radiologic imaging tests that will confirm our diagnosis. In this case, you may have to do a swab test. Doc Freddy?
Now, Dr. Marion, when it comes to pneumonia, is this, even in the mildest cases of pneumonia, is this something that our viewers or someone who has it, can this be managed at home?
Yes, in fact, there are some types of pneumonia that we really treat at home with oral antibiotics, especially for the community-acquired pneumonia cases that are bacterial in nature. For those naman with COVID-19 pneumonia, there are some that are also managed at home, especially if they don't have any risk factors for developing severe illness. And usually for viral types of pneumonia, they can be self-limiting, meaning you don't even have to give any particular medication for it to contain itself, whereas for bacterial pneumonia, these are the ones that you really have to give antibacterials. And I'd just like to add that these pneumonia, whether it's viral or bacterial, they do have the propensity to progress. And symptoms that you have to watch out for at home would include increasing work of breathing. You know, when someone starts to feel that they are increasingly tired with just their basic activities of daily living. And then for some older patients, they can have difficulty waking up, which could suggest a more severe type of pneumonia or even sepsis.
But during the diagnosis for pneumonia, your doctor will start asking several questions about your medical history, such as recent travel, your job, your contact maybe with animals or exposure to other sick people. And aside from these questions, your doctor will conduct a physical exam, such as listening to your lungs with a stethoscope, as well as other diagnostic tests might be asked. Dr. Ivan, what happens during the diagnostic examination para may idea mga viewers natin?
So I guess you're asking what will be the diagnostic clues. When we do our physical examination, you know, we see a patient who comes to us or to the emergency room, they are anxious. Okay, they're anxious, they are in distress. Some of them, it could be mild to severe distress. They have a fast heart rate. And when you listen using the stethoscope on their lungs, you will hear what we call as crackles or ralls. And that would certainly indicate with a high probability that that is pneumonia. We must emphasize this. The symptoms of COVID are very protean. It is not limited to the lungs. Sometimes COVID will present as a heart attack. Sometimes COVID may present as a stroke. The point of this is when we examine a patient, when we make our diagnosis, we should not only focus on that lungs because COVID is a mimic of so many diseases.
Pneumonia can affect anyone, but some are at higher risk than others. More on this when we return. We're here to help make a healthy lifestyle a priority. You're watching MedTalk Health Talk on CNN Philippines. Pneumonia is a symptom of COVID-19, but a test is needed in order to determine the nature of one's condition, which means treatment may be different. We're together in health. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. Although anyone can get pneumonia, it's more common in certain groups. Dr. Marion, who are at high risk for pneumonia?
So those who are at high risk for pneumonia in general are those who are very young or the very old. And then other people with medical problems such as diabetes, chronic smokers also are at high risk, and those with chronic pulmonary illness also have the tendency to have more severe types of pneumonia.
So these high-risk groups that you mentioned, Dr. Marion, kapag sila ang nagkaroon ng COVID-19, is it safe to say that these people have a higher chance of progressing not just to mild symptoms, but to maybe moderate, even more severe type of symptoms?
Yeah, that's correct. No, that's why we are very careful when we have patients that belong to this population of individuals.
Dr. Ivan, what can you advise these high-risk groups?
As we have said, that pneumonia can affect all ages, but the elderly are at greatest risk. And these conditions that have been mentioned already, which is smoking, obesity, and may I add, a weak immune system, such as those who are on drug treatment or health problems like diabetes, heart disease, liver disease, cancer, HIV, stroke, transplant patients, COPD, and even kidney failure, those on dialysis. And I guess that is very important for our viewers to understand that they have to be careful and tell their doctors, ito po ang aking mga problema. And that puts us on an alert. Kaming mga doktor, ay teka, mataas ang risk mo to have a progressive disease.
In the meantime, what we want to stress is that pneumonia is a very serious condition that it can affect people in many different ways, as well as bronchitis and pneumonia, which have similar symptoms, and they both affect the airways, resulting in coughing as well as discomfort. Dr. Ivan, how can you differentiate the two, someone who has bronchitis and someone who has pneumonia?
When we say bronchitis, it is an inflammation of the bronchial wall. So that's bronchitis. Anybody can just come in with cough, but it is not accompanied. When you do auscultation, though, they don't have crackles or rals. And when you do an x-ray, they may have a normal x-ray. Unlike pneumonia, which means an inflammation which goes down beyond the bronchi, down to the alveolar sac, and causing some inflammatory fluid there in the alveolus, which will explain the rals of the patient. So bronchitis versus pneumonia. Medyo madali pa yung bronchitis eh. And when we talk about pneumonia, for the rest of our talk, Doc Freddy, we're referring to what we call the community-acquired pneumonia, which is a terminology we used even before the pandemic. And now, we call it now the COVID-associated pneumonia.
Okay, that's very good, Dr. Ivan, that you mentioned that, the COVID-associated pneumonia. Now, my question with Dr. Marion is, marami rin nagtatanong, kapag ang isang tao ay may pneumonia, ay madali ba itong makahawa ng ibang tao? Then, please explain if this is contagious and how does this spread?
Okay. So pneumonia and influenza are both respiratory illnesses that are spread through the droplets. So we release droplets when we are coughing, when we're sneezing, when we're talking. And it's important that someone who is ill with any respiratory infection, so that's the purpose of the masking, because that would limit the number of droplets that you spread. In COVID-19 in particular, there are already increasing data that it can spread through the air, meaning that someone who is ill may not be in that room anymore, but if that room is not ventilated enough, it is possible for someone to inhale infected aerosols. So it's important to understand that transmission can happen because of these droplets or infected aerosols. And it's important to cover our cough. If we are coughing in our hands, we have to wash our hands. We can spread the infection when we touch our eyes, when we touch our nose, and then when we touch other things, we can potentially spread these droplets around the house. So this is one of the things that we always emphasize in infectious diseases and infection control. Hand hygiene, while it seems simplistic, actually is a very effective way in controlling the spread of infection. So those with pneumonia at home, we do expect them to follow what we also advocate for COVID-19 prevention, which is hand hygiene, ensuring adequate ventilation and air circulation, physical distancing, wearing a mask, face shield, especially when you're outside, and limiting your interactions. Now, in addition to prevention, while we're at infection control anyway, we mentioned earlier that those with chronic medical conditions like HIV, diabetes are prone to getting infected. So these individuals should take their maintenance medications to control their underlying medical problems, and vaccination also can help in the prevention of disease, infection rather, and severe disease.
Cannot emphasize enough what Dr. Marion mentioned, that the most simplest things that we think we are doing is actually very effective in trying to control the spread of disease. And here's some more piece of good news. Pneumonia can be prevented. When we come back, we'll talk about how to prevent this condition, especially in this time of COVID-19. You're watching MedTalk Health Talk on CNN Philippines. Prevention of any disease is a top priority in this world that we live in today. I'm Dr. Freddy Gomez, and you're watching Med Talk Health Talk on CNN Philippines. These days, it's really all about maintaining good personal hygiene, staying healthy, and boosting your immune system to prevent any type of diseases such as pneumonia. Dr. Marion, let's discuss how these steps can shield us from pneumonia and COVID-19 especially.
Okay, so for the hand hygiene, someone who is ensuring that they are cleaning their hands properly would limit the propensity for spread of these infected droplets that we talked about earlier. Now, I would like to focus also on vaccination because we are currently rolling out our vaccination for COVID-19, and then we also have, even in the past, we have available our influenza vaccines and also our pneumonia vaccines. But for the common cause of bacterial pneumonia, which is Streptococcus pneumoniae, it is vaccine preventable, and this is offered to individuals with medical problems, those who are working in the healthcare facility where they are prone to getting exposed. For our seniors, we also recommend this, and also for the pediatric age group, they have their pediatric pneumonia vaccines available. For influenza, this is an annual vaccine because every year there are different circulating strains of the influenza viruses, and this is very important in preventing severe disease or severe illness from the influenza, and also for COVID-19.
Dr. Ivan, what kind of vaccines should our viewers know about in order to prevent pneumonia?
Number one is that you get a flu shot every year. That is to prevent seasonal influenza. Remember that the flu is a common cause of pneumonia. So it makes sense. Preventing the flu is a good way to prevent pneumonia. Now, for protection against certain bacteria that can cause pneumonia, we follow the CDC, which recommends 2 pneumonia vaccines. They call, number one is the pneumococcal polysaccharide vaccine, and that's recommended for 65 years and older, and anyone basta mayroon siyang underlying condition that increase the risk for pneumococcal disease. And then number 2 will be what we call the pneumococcal conjugate vaccine, which is known among lay people as the single dose. Sometimes the word lifetime is being used, That is the PCV13. I would recommend that you talk to your doctor about getting one of them. Now, it must be pointed out, Dr. Freddy, this is very important, that while there are COVID vaccines available, they do not protect you from pneumonia. The pneumonia vaccine protects against a kind of bacteria, not the coronavirus.
Dr. Marion, for those who are still hesitant in taking the vaccine, whether for COVID-19 or for the flu, what is your advice for them?
We have to understand that bacterial pneumonia, such as those caused by Streptococcus pneumonia, not only causes pneumonia, meaning infection in the lungs, but they can also cause invasive pneumococcal disease, meaning it can cause sepsis, it can cause meningitis. So these are the things that the vaccines are helping us for, so that if ever we do get infected, we don't develop the severe disease. And for influenza viruses, we do have the seasonal influenza, and these things also have been in use for several years already. And this one has a very good safety profile, and this has been proven to prevent ICU admissions due to influenza. So I think it's better to have the protection that we can have, the protection that we can offer from vaccines.
Can't stress enough how important it is to get vaccinated. Now, treatment for pneumonia will depend on the type of pneumonia you have, your age, and other health conditions that may be present. But the goal of the treatment is to cure the infection and prevent further complications. Dr. Ivan, what is the treatment required for, let's talk about both viral and bacterial pneumonia. What's the mainstay treatment for this?
Now, it's important to remember that before we initiate a treatment protocol, we need to do risk stratification. What does it mean ba? It means classify your patient pneumonia as mild, moderate, and severe, after which you can now apply the algorithm. Algorithm is a clinical decision process that we undertake. Now, the critical decision to be made is whether the pneumonia should be managed as an outpatient or home therapy or for confinement.
It's good that there is treatment for this, but best pa rin is to prevent this. So, Dr. Marion, what's your advice for our viewers how to keep their lungs healthy, how to prevent themselves hopefully from getting further diseases?
Okay, so as part of prevention, so we talked earlier about vaccination, but it's also important to maintain personal hygiene and respiratory or cough etiquette even at home. It's also important to emphasize a healthy lifestyle. So physical activity is very important. In fact, as far as COVID is concerned and even other diseases, sedentary lifestyle increases your risk also of developing more severe illness. So it's good to have some form of exercise or physical activity. And then it's very important to be compliant with any maintenance medications you may have, control of any underlying comorbid or medical condition like HIV and diabetes, to name a few, to improve your chances of not getting any illness.
And with that, we wrap up another interesting episode today. I'd like to thank our guests, pulmonologist Dr. Ivan Villespin and infectious disease specialist Dr. MARION AURELLADO-KWEK. We appreciate your time as well as your effort and your expertise very much. Now, our lungs, just like our hearts, joints, and other parts of the body, age over time. By adopting healthy habits, we can keep our lungs healthy and in tip-top shape even during our senior years. I'm Dr. Freddy Gomez, helping build a healthier future for you. Thank you very much for watching.